Hi everybody, I'm Mark Elliott. I only speak for myself in these videos. Today I wanted to extend the previous talk on addiction more generally to how to actually address addictive behavior of all kinds. Last time we talked about how addiction is primarily about a lack of control over the behavior and big negative consequences, right? Which can really be enormous consequences in people's lives due to their addictive behaviors of all kinds. The question becomes, what do we do about these behaviors? Well, the first step is recognizing them for what they are, right? Is part of the reason that I talk a lot about things like smartphones and other kind of more universal addictive behaviors that virtually everybody has. Because it's easy for us to discount how harmful our rewarding, satisfying, repetitive behaviors can be. Probably the biggest one when you think about things like phone games and social media is just time, right? The amount of time that we could have been doing literally anything else that we spend doom scrolling, right? So once we've figured it out, what do? I am the number one advocate I know in the addiction world for the just stopping it strategy as a first go. I think it's underrated, and I think the vast majority of people who quit things do so with that strategy. The number of people I know with long-term methamphetamine habits and gambling habits and things like that they quit, just dropped cold turkey 20, 30 years ago, is a testament to that strategy. And I think sometimes it's underrated and certainly a first go-to for most people, obviously barring the dangerous medicines to come off quickly like alcohol or benzodiazepines or even opioids. But I think ultimately for most addictive behaviors, stopping and continuing to stop in one way or another is the primary strategy. And there's a lot of different ways that people do that. Probably the most important thing that I hear from a lot of people, and there's now some pretty good formal research to back up the fact that exercise of a lot of different sorts will have a substantial positive impact on changing habits, kicking bad ones. Somehow it seems to do that. I think one of the most reliable and oldest strategies is mindfulness practice. Formal meditative practice is an old technology to boost cognitive performance, essentially, in a variety of domains. And I think one of them is managing urges such that you're not controlled by them. A lot of people turn to 12 steps of various sorts: Alcoholics Anonymous, Narcotics Anonymous, Marijuana Anonymous, Sex and Love Addicts Anonymous, SLAW, and the list goes on. And these communities are everywhere and wonderful, and I think do a lot to replace a lot of the social deficit that can come from abstaining from drug of choice. And it's a beautiful community, and there's nothing like it. Unfortunately, a lot of people don't like going to those meetings very much, or at least the meetings that they go to. And there are a lot of meetings, but it really does work when you work it, and you know, get a sponsor and get a sponsee and that kind of accountability and community. There's just nothing like the rooms for that sort of thing. So if it works for you, I would highly recommend some sort of community-based abstinence group if you're finding it difficult to remain abstinent of something. There are many groups online and elsewhere, kind of all over the place at this point, for almost anything you can think of. So look around if you're interested in that sort of work. Another technology that's so hot right now is the psychedelics of all sorts. And certainly they have a long history of being used for addictive behaviors back into the 50s. More recent research is not very substantial, really, but I think is promising, and I think it will be more of a target going forward. I know there's research being done. So as usual with psychedelics, it's promising, but it's almost certainly not a cure-all. One particular psychedelic called iboga, or the chemical name ibogaine, I believe is how you say that, has been noted to have particular anti-addictive properties, especially for people with opioid issues, but also others, as I understand it, though research, as usual, is lagging behind the field work. And we'll see how things move forward as the research gets better and hopefully access is increased over time, and we'll see how things pan out. So what about rehab? I've had very mixed feelings about rehab for a long time. They don't have the best efficacy numbers from what I've seen, although they're rarely really available. I think that there's two main problems with it. One is that it can be a very temporary solution to a very long-term problem, and relapse rates can be enormous if it's not done carefully, and or it can be quite expensive, especially for the longer treatments, which do seem to probably work better if it's a few months rather than a month. But it's quite expensive and most people can't afford it. How much an outpatient psychiatrist might be able to help you really depends on the problem and depends on the psychiatrist. But for some things, medicines can be helpful, like most notably naltrexone for alcohol and things like Suboxone and methadone for opioid addiction. I also have to mention a tool called motivational interviewing, which I think is one of the best tools that we as clinicians can use to help bolster the motivation of our patients and help them achieve goals that they struggle to motivate around, including abstain from substances, amongst other things. So to sum it up, if you're trying to stop doing something that you've been doing for a while, the first thing I would do is really acknowledge how much of a problem that thing has become in your life, and really try to think about the costs that it's incurred on your life as best you can. And if you really build the willingness to stop, to set aside a date, sometime in a few weeks or a few months, when you feel like you're ready to disconnect, and really prepare for that, and tell your family, tell your friends, any sort of clinicians that you're working with, that you're going to stop on that date. And then in preparation, to just scrub your life as much as you possibly can of any sort of remnants of that chemical or that vice of whatever it is. And then to really try your darndest to stick to it, and continue sticking to it as best you can. And that's knowing that relapse is a part of recovery, and almost inevitably you'll stumble at some point. But the key is to just keep back up and keep stopping. And things that can help us with that are exercise, first and foremost, getting outside and moving your body as much as you can. Formal mindfulness practice that can include meditation or yoga or mindful walking. I should say sitting meditation. I lie down to meditate personally. And the last thing is community, and particularly a community that doesn't engage in the behavior that you're trying to disengage from, which can be really hard to come by because a lot of the time, drugs and other things come with friends, and it can be really hard to disconnect from that, which is certainly why I think 12 Steps is worth a look if that's something that you're interested in, or some other sort of community-based group, and to be connected with your family and your friends too in the process, because frequently we withdraw into our addictive behaviors. In this video, I really focused on what an individual can do, as far as addictive behaviors go, which you might notice somewhat limited. In the next few videos, I'll be talking about what we can do on a more societal level to address the negative consequences that come with addictive behavior. Thanks for watching. Talk soon.